Welcome to Girl Talk with Dr. Bajaj and myself, Connie. I'm her patient consultant. Today we're going to talk a little bit about what we would tell our younger selves about body confidence. We have gotten a lot older and wiser and more mature, and there are some things that, gosh, if we would have known what we know now back then, right? What are some of the things that you've experienced in your own personal journey that have enhanced your body confidence?
First of all, I do not want to be my younger self at all. When I was younger, I think I was very self-conscious about all aspects of my body. I thought my thighs were too big, my breasts were too small, and that I had too much hair.
Just hairy everywhere. Well, we go through all those hormonal, we're teenagers and the hormones are happening and all of a sudden our body is changing. We feel like everyone's judging us, right? We're fixating on it and we just know that everyone's looking at us and they're fixating on it as well.
But they're not.
They don't care. They don't even notice. They're fixating on their own issues.
That's the truth. Most people, and even today as adults, we may fixate on certain things about our appearance, but the reality is nobody else notices it.
I guess nothing's changed. We're still doing it. No, but at least we know there are things that we can do. And I think that makes it really relatable as women in the business that we're in, this industry that we're in, and as we're talking to them, we can say, hey, I was there, I've been there, and it's okay to want to change it. It's okay to want to do something about it. You have a pretty interesting, right, the things that you've been able to do. Well, you've had access to this stuff
That
too.
would be true. So I always used to think my thighs were too big. And so I'm not a big person. And I had what most of us call saddlebags, like they're big pooches on the outside of your thighs. And my waist was small, and so I used to have to buy a size of pants that was bigger just to go over my thighs. And so in my 20s, I had liposuction of my outer thighs, and that was life-changing for me because all of a sudden I could wear clothes or even dresses that weren't too tight over my hips, but they were meant to fit my body shape and size. So to me, I felt like I was more proportional with that.
Was that a hard thing to kind of decide to do, or because you're kind of in that world, your dad is a retired plastic surgeon, so it's not so taboo in...
Oh, it was totally taboo.
Was it?
I mean, when your dad's a plastic surgeon, he doesn't want his daughter to have plastic surgery.
All right. Yeah. Well, yeah, father-daughter situation there. But you did it. Have you ever regretted it?
I have never regretted it, ever.
Has it aged well?
It's aged fine. Actually, after I had the liposuction, I did have some contour irregularities, which we know is a complication of liposuction, or it can be. But it was still 100% worth it. As an adult, about 30 years later, yeah, because I was in my 40s.
About 30 years
we
later.
adjusted the contour a little bit, and now that little divot that I used to have is gone. But I did used to have a noticeable divot. It didn't bother me because the overall goal of having my pants fit was great.
Right, because that was the goal, right? It changed how you put on your clothes. Sometimes I'll say to patients, maybe I'm not normal or maybe this is unique to me, but I don't stand in front of the mirror naked and judge my body. I don't, sorry. But I do stand in front of the mirror in my clothing and judge my body. That's what bothers me. That's when I'm like, ooh, I need to make a change. It's because of how my clothes fit. If we were to, before surgery or after surgery, nobody's going to be happy if you're staring at your body in the mirror naked. But put your clothes on, and if you can zip it, if you can do this and you feel confident and you see all those curves, then that's the main focus, I think.
I agree with you because when we look at ourselves naked, we're going to see scars and we're going to see the things that we can nitpick. And nobody's body is perfect when you're standing naked in front of the mirror. I'm going to be honest. I have yet to see that. And I see a lot of people in my office.
Right. Naked. Just totally denuded of all their clothing. Right.
Yeah.
What about one of the other things that you've done? Okay, move forward in your timeline. So first, that was your first
That was
procedure?
my first, was liposuction. My second was laser hair removal, actually technically laser hair reduction, which came out in probably the early 2000s. And that's also when I got it done. One of my friends opened one of the first med spas in Southern California, and I was one of his test patients for laser hair reduction. And the main reason is, the one reason I wanted it, I have dark hair. And when you shave with dark, thick hair, it's like you get a 5 o'clock shadow all over your legs and pretty much
And
everywhere.
Yeah.
So that was life-changing for me.
Yeah, same. I did laser hair removal reduction to my underarms, and it was because I had just chronic razor burn. 5 o'clock shadow, literally, like 8 hours later after shaving. You're like, why? What's the? And it just seems like it's unfair. Is anyone else dealing with this? I felt like I was I just felt like it wasn't fair. I didn't feel like anyone else was complaining about it or walking around with their arms down because they either had bleeding, razor burn, or hair growth. And so I did the same thing. I had that done, and it was just life-changing to be able to walk around with my arms up, to wave, to wear a tank top, and not have to worry about that.
And you also have less sweat when you don't have as much hair on your underarms.
Yeah, true.
Which is a big deal.
Yeah. And what's next? Then what'd you do?
So then after that, something that I had wanted since my teenage years was a breast augmentation. But as you mentioned, or as we've talked about, my dad was a plastic surgeon, and he was completely against it. And so the reason I wanted it, I was flat-chested, like literally flat-chested. When I say flat-chested, I mean there was nothing there. And
everyone picture this in your mind.
I mean, it was nothing. But, and I used to wear those Victoria's Secret bras. If anybody is old enough to remember, they had these water bras.
The water bras.
That were stuffed, padded bras filled with water.
They weighed like 20 pounds.
And then they also had the air bras.
Oh, yeah.
Where if you
They made these hilarious. Yeah.
I
Here's
know.
what
So
we're
it's
doing.
all these contraptions.
Such false
And
advertising.
then they have a swimsuit, too, that had the same contraption.
Yeah.
And so I never felt comfortable in a swimsuit. I always felt like, once again, that I was out of proportion. And then one day I went for a run, and I was wearing running shorts and a sports bra. My dad told me I had the body of an 11-year-old boy. So I said, done. Anyway, so shortly thereafter, I got my breast implants, and I've never looked back.
Same. Gosh, I know. I'm like, I'll just tag off of your stories. Every time I'm like, me too. Except I never did have liposuction in my thighs, because every time I asked for it, she goes, no, Connie, you don't need liposuction.
Well, you don't.
But I think that the breast augmentation, such a good relatable story for women who call us and they're going, I'm not trying to do this for attention. I'm not trying to be a swimsuit model. I'm not trying to whatever. They're like, I just want to wear things. I just want to fill out the top. I just want to, shirts that have darts in them. They're there for a reason. They're there because women have curves, and yet some of us were not blessed in that way. And we want to do that. Then talking to a patient helps them reassure them. I've been there. I can be a good resource for you. I think that you make a really unique resource for patients who want to have someone who will listen to them and understand that they don't want to go huge and they don't want to have like in your face breasts. And then you're like, yeah, I get it, because you're not in anybody's face either.
No.
So they're right. Yeah.
But they shouldn't. I mean, I'm not a big person.
And
so.
also for when they go, are they safe? Are these going to be safe to put in my body? What are the risks? What are the complications? Oh, should I do it? If a male surgeon says, oh, they're safe, it's fine. It's like, well, would you put them in your body? Well, no, because that would be weird. But it means something when your surgeon says, they are safe. I feel I've done the research. You're well researched and well educated in the breast implant industry, breast implant technology, and where we are with the advancements and everything. And even ours are old too, and they were still safe enough to put in our bodies. I think that means a lot more coming from someone who has them.
I think it makes a big difference. I mean, at least as a woman, I know what it feels like to have breast implants. I also know, you know, when women, a lot of women, once they have breast implants, are also afraid to get mammograms. And I get it because it is uncomfortable, but that shouldn't dissuade you from doing it. And I can speak to that from a personal level because I've had my freakouts with getting mammograms and implants.
Like what? What's the story?
So my first set of implants were saline implants. And as Connie mentioned, most of us, she doesn't stare at herself naked in the mirror. I didn't stare at myself naked in the mirror either. But I had a really bad mammogram experience where it was painful, it was uncomfortable. They're trying to smash everything into into that machine device kind of thing. And afterwards, I felt like one breast was smaller than the other. And in my mind, I had 100% convinced myself that this mammogram had ruptured my breast implant, which is a common thing that a lot of women will tell me. I totally flipped out. I called one of my friends who's a plastic surgeon, and a couple of weeks later, we removed and replaced my implants with silicone this time. But guess what?
Fully intact, weren't they?
Yes, they were.
But once you notice something, you can't unsee it. And you didn't notice it before, so you're like, I don't know, was it this way before my mammogram? Is it this way now? Why? So very relatable, but we all have our...
It's the same thing that happens with all of us. Like we have a specific mark that or incident in time to which we're able to relate that to, and that's what we associate the problem with, even though it's probably been that way forever.
Yeah, right. And I don't know, I would say none of these things that we do...
What?
I was going to say, well, what was the next thing you did?
What was the next? Oh, my eyes? Oh, yeah.
I'm telling you, we are such nerds. Like literal nerds, guys. We both had our upper blepharoplasties within like a few weeks of each other. Can we just not copy each other for one? No. So it's fine. It makes it to where we can just have compare, contrast, be girlfriend. It's girl talk. It wouldn't be girl talk if we didn't have the same things to talk about, right?
I guess not.
Yeah. So I think it just works. Anyway, so tell us about your experience. I had a really good surgeon, by the way. So my results are very natural, very refreshed looking.
Who was your surgeon, Connie?
Her name was Dr. Anu Bajaj at Bajaj Plastic Surgery. Very, very wonderful technique. And I was a very good patient, and I followed all of the recommended protocols that I recommended to myself. With, no alcohol, no NSAIDs for the week before, high protein diet, 3 protein shakes a day, getting that 100 grams a day, and reduced my sodium, all the things because I wanted to speed up that recovery process. I wanted the minimal amount of bruising and swelling that I could possibly have. And was that week ahead of surgery fun? Not really. No. I was like, but it's going to be worth it. I know it will be. Had my procedure, went by in a blink of an eye. I was going to say that's. And like I said, I had a really wonderful surgeon. So I've had amazing results, and I have not regretted. Every day I wake up and I'm like, I'm so glad I did this. This is the best thing I've ever done.
So I wasn't a rule follower. So I had bruising. I had a black
Most
eye.
Most people do.
It took me a little bit longer to recover. So yes, it's better to be a rule follower sometimes.
But in the end, what does it matter, right? It just shortened my recovery time. It just shortened my those symptoms that you experience after surgery. You still have great, not as good of results as mine, but
I can't do my own surgery.
I can only tease about it. I just tease about it. She still had a good surgeon. And what's next? Anything on the list for what you want to do next in your own personal?
Maybe one day if I can stay off my bike for 6 weeks, I would do a labiaplasty.
Mm-hmm.
But that means not riding my bike for 6 weeks.
You can't do that yourself either.
No.
I don't think you can do that one yourself. I have seen her do her own injectables. I've seen her do, her Botox, her filler to herself. There are a few things that you can do.
Yes.
But at some point, you have to.
And at some point, you
Ask
got to
for-
say it's not going to happen.
So thank you for joining us for Girl Talk with Dr. Bajaj and Connie, where confidence looks good on everyone.
And we will see you next time. So it's a good day to have a great day.